patients, we sometimes face some questions from them. Many times, patient asks us, "Is heart attack and cardiac arrest the same?" That is very common question that we encounter. Heart attack and cardiac arrest. They are not the same. I will elaborate on that in my subsequent slides. And there is a lot of questions regarding blood pressure, regarding high cholesterol levels, regarding diabetes, regarding stress, regarding diet. What sort of diet should we follow? What type of oil should be used? What should be the quantity of oil that should be used? So all this we are going to cover in our subsequent slides. I want this talk to be an interactive session. So anytime if you have any doubt, you can interrupt me in between, and so we can have a discussion rather than me going through the slides one by one. It will be better if we have an interactive session. If you have any sort of a doubt, however trivial you might feel it is, you can be free to ask me. You can interrupt me and ask me. Okay. So when we look at the heart, actually heart is nothing but a pump. Okay, it receives blood which is less in glucose and oxygen from all over the body, from the legs, from the arms, from the head, brain, from the internal organs. So this blood which comes to the heart through a system of vessels which are called as the veins. The veins bring the blood back to the heart from different parts of the body. So the blood which the vein brings, that is very less in oxygen, it has very less glucose. Once the heart receives this blood comes to the right side of the heart. Right side of the heart has two chambers, the upper chamber, the right atrium, the lower chamber, right ventricle. So this gets the impure blood, the blood which is less in oxygen and less in glucose. So the heart, right side of the heart pumps this deoxygenated blood to the lungs. It supplies mainly two vessels to the lungs. So this blood which is less in oxygen goes to the lungs. In the lungs, the oxygen which we inhale gets mixed with the blood. And this oxygenated rich blood comes back to the heart, to the left side of the heart, left atrium, then it goes to the lower chamber of the left side, left ventricle. And from the left ventricle, it is distributed to the whole body. So our heart works tirelessly. It doesn't take rest even for a minute. The moment we are born till we die, it works continuously. It has muscles which work continuously. So anytime if anything happens, we die because the circulation is very important. It is very important to maintain the glucose and the oxygen supply to the whole body. And the heart does that. Heart is a pump which works tirelessly right from the time we are born till we die. So this is the main function of the heart, to supply oxygen and nutrients to each living cell in the body. This is what I was talking about. This is shown in a diagrammatic fashion in this diagram. So heart, the muscle itself also needs some blood to work tirelessly. It also needs oxygen and glucose to work tirelessly. So this is supplied by some small vessels which will be on top of the heart muscle, and some small branches which go on penetrating the heart muscles. These small vessels are called as the coronary arteries. The coronary arteries, they supply blood to the heart muscle so that it can work tirelessly without any interruption. So in diseases which lead to heart attack, which we call as the coronary artery disease, what happens? Some cholesterol starts getting deposited in these small vessels which are on top of the heart. So the vessels are like a pipe. They are a conduit for the blood to go. Once the cholesterol starts getting deposited in the vessels, the lumen of the vessel, the hole through which the blood passes, that becomes compromised. The cholesterol starts encroaching the lumen. Okay, so the amount of blood that it allows to go, it decreases. With increasing blockage, once the blockage becomes more than 70%, patient starts becoming symptomatic. They can develop chest pain, they can develop breathlessness while they are walking, they are doing any heavy exercise, or they are climbing the stairs. So this is the initial symptoms once the blockage level crosses 70%. Then if the blockage becomes 100%, then when the patient develops a heart attack. Heart attack develops only when the blockage becomes 100%. So these small vessels are there. These are the coronary arteries, what I was talking about. So these coronary arteries, they divide into small branches. They go inside the muscles and they supply blood to the muscles. So if the blockage develops in this coronary arteries, this is what we call as the coronary artery disease. So once the blockage level increases more than 70%, then the patient starts developing symptoms. So these blockages don't develop over the days, weeks. It takes months or years to develop. Sometimes some people may die in accidents. So in Western countries, they do a pathological autopsy in all such patients. So what they have found, even in young patients who have died in their late teens, maybe 17, 18 years, 20 years, they found this evidence of cholesterol deposition starts very early in life. Even people who have died between 10 to 20 years of age, there were some deposits of cholesterol in these coronary vessels. So it is wrong to think that this is a disease which starts developing in adulthood. It starts developing in the teenage itself. So the preventive aspects should start in the early years of life. Okay, then only we can prevent this. So though it takes many years for the cholesterol to build up to reach a stage where it causes the symptoms, but the actual process starts quite early in life. So these are the various diseases of the heart. So here our focus here mainly is on the coronary artery disease, atherosclerosis, chest pain. These are all manifestations of the same disease. Then there are some diseases which are related to heartbeat. We have a heartbeat which is mostly regular and most of the time it is between 60 to 100. But there are some diseases where the heart beating becomes quite irregular. We call it arrhythmias, atrial fibrillation and other things. So those are other types of diseases which can affect the heart. Then we have some diseases which are present right from the birth, which we call as the congenital heart disease. There will be some holes in the heart which children have. So those things are not preventable actually. So we are not going to focus more on those. And there is some infective disease of the heart called as the rheumatic heart disease, which was quite prevalent in the earlier times when our sanitation levels, our socio-economic status was very poor. But nowadays we see less of rheumatic heart disease. Once the sanitation and other things have improved, these disease has prevalence has come down. So this is what I was talking about. This is the cross-sectional area of the vessel. This is the lumen through which the blood flows. So once the cholesterol deposit starts, this is how the cholesterol deposit starts. Once it increases, you can see the circular area. It goes on getting reduced. So here you see it is a very tight blockage. This is the only area which is left. This is 90% blocked. And once what happens, this thing ruptures here and it causes total blockage. That is the time when the heart attack develops. So this takes many years to develop. The process starts in the teens, and by the time in 40s or 50s, we develop the signs and symptoms of heart attack. But this process starts quite early.
Sir, for the checking that one, as you earlier said, okay sir, how we can go that one for the medical, how we can check it is what is the blockage percentage? Is there any
Yeah, see the thing which starts in teens, that is only as like we call it fatty streaks. There are some cholesterol deposits in the vessel wall. That stage of disease cannot be diagnosed with diagnostic tests that we have. So 10%, 20% like this, it can be diagnosed with a CT scan. But the early one, which is in the form of only a streak, but there is no percentage narrowing, that can be diagnosed only by autopsy. So this we just autopsies have
normal process. No, we have to go for the extra things only.
Which one?
It means we can't go by this is the normal pathology. They
No,
can't
most,
determine like
most,
that.
most of the healthy people will also start developing that fatty streaks quite early in life. So that the autopsy studies were done in apparently very healthy individuals, and they found that the cholesterol deposit starts at that age. So why I am bringing this just to highlight how important it is to adopt healthy lifestyle and other preventive measures which I am going to talk about in my subsequent slides. So it's not that we should start exercising once we are 30, 40s. We should inculcate these habits in our children also. That's what I am trying to tell. Okay,
no,
so
what is the procedure to know what is the percentage of deposit of cholesterol?
Yeah, that is we can do it by CT angiogram or we can do by normal angiogram also. Okay. There are other non-invasive tests like a treadmill test and all, but they can detect blockage only above 70%. The treadmill test result comes as positive or negative. It becomes positive only when the blockage is more than 70%. Below 70%, it will come negative only. It cannot diagnose the exact percentage. But CT scan, CT coronary angiogram, or a normal angiogram can diagnose the blockage, even 10%, 20% blockage also we can diagnose. But that is not required in all individuals. That is not required in all individuals.
Irregular heartbeat. There is any medicine for the disease?
That irregular heartbeat is what we call as arrhythmias. So arrhythmias are not all arrhythmias are same. There are different types of arrhythmias. Even among arrhythmias also, there are some categorization. So treatment depends on what type of arrhythmia you have.
So
It's not the same medicine which works for all. Arrhythmias, maybe 10, 15 types of arrhythmias are there. So this ischemia is nothing but when the blockage increases to significant extent and it decreases the blood supply to the muscles. God has made us with a lot of reserve actually. So our coronary arteries also, till the blockage increases to more than 70%, we don't feel symptoms. Till 70% also, the blood supply is enough to meet the demands of the heart. So there is a lot of reserve. Even in the kidneys, if you see, unless 75% of the cells are damaged, your creatinine doesn't start increasing. So there is a lot of reserve in the kidneys also. Similarly, lot of reserve is there in the heart also. We don't need the whole diameter of the coronary arteries to maintain the blood supply of the heart. God has created the size more than like only 30% of the size we need to maintain the blood supply. So the blockage, once it develops slowly till it reaches 70%, we don't experience any symptoms. If it increases to more than 70%, then only symptoms start appearing. A 50% blockage will not cause any symptoms. So we don't treat also by means of stent or bypass surgery if the blockage is less than 70%. Above 70% blockage only is treated by means of stent or bypass surgery. So there is a lot of reserve. And once the blockage increases to more than 70%, what type of symptoms person can have? Most common symptom is while walking, while jogging, or while climbing stairs, while doing any physical work, they will experience some tightness in the chest. So it's not always pain. Some of them can have only some burning sensation in the chest. Some of them can have a pain. Some of them can have only breathlessness, and some of them can have a heaviness in the chest. Once they stop their activity, if they are walking, if they stop walking, if they are running, they stop running, if they are climbing, if they take rest for 2 minutes, this pain or this uneasiness in the chest subsides. So that is the most classical symptom of what we call as the angina. Sometimes this pain can radiate to the left hand also. Sometimes it doesn't radiate to the left hand in all the people, but around 50% of people can experience pain going to the left hand also. Along with the chest pain, they can have pain going to the left hand. Sometimes they can have pain in the jaw also, but this pain comes while doing any activity, while doing any physical activity, and they take rest for 2 3 minutes. This pain subsides. So this is the very classical symptom of coronary artery disease. So this is a classical symptom of angina. This happens when the blockage levels are more than 70%. Even a single vessel blockage can give rise to same symptoms. If they have blockage in 3 vessels also, they can have the similar symptoms. Symptom doesn't help us to decide what is the extent of disease inside. Even a single vessel can give rise to similar symptoms. Apart from this, other symptom is breathlessness. Sometimes while climbing the stairs, they will feel short of breath. They have to take multiple breaths. They have to take deep breaths, and once they stop, the breathlessness subsides. But they can sometimes, very rarely, they can have profuse sweating also. But sweating and all more often happens when they develop a heart attack. That time the pain doesn't subside even after taking rest. They will continue to have severe pain, and the pain is many times very unbearable. They will describe that a very heavy weight, like 30-40 kgs weight, has been put on the chest. Along with the pain, they will have sweating. They will have sometimes vomiting also during the attack. So this is a very common symptoms. But all patients may not have this classical symptom, that we have to understand. Particularly diabetic patients. Sometimes diabetic patients can have very atypical symptoms. Sometimes they can come with only abdominal pain, and sometimes they go to the ENT because they get throat pain. They think that it is because of some throat problem, but it can be a heart problem. So sometimes diabetic patients can have a silent attack also. Without their knowledge, they develop an attack. Sometimes they could go to the doctor later. Doctor does a ECG, and then the doctor asks, did you have an attack or not? So diabetic patients, it is very common to have silent attacks also without developing any symptoms. Particularly in sometimes even in female patients also, the symptoms can be very atypical. So if you are not having typical symptoms, that is also a disadvantage because your disease is not going to diagnose at the correct time. Maybe by the time it is diagnosed, it is quite advanced. If you have the symptoms early on, it is an advantage to the patient. But if you don't have symptoms, if you develop a silent heart attack, sometimes by the time the disease is diagnosed, disease is quite advanced and not much treatment options can be offered to the patient. This is what I was talking about. So sometimes that heaviness is so heavy. Some patients describe that the elephant has been put on the chest. Sometimes they can have nausea, vomiting, sometimes very severe sweating. So this is the symptoms of the heart attack. Earlier I was talking about in my introductory slide, some people ask whether heart attack and cardiac arrest are one and the same. They are not one and the same. Cardiac arrest is when the heart stops beating. So any disease, whether it is a brain-related disease, ultimately it will a person is going to die once the heart stops. So heart attack is not the same. Heart attack is only when the vessels of the heart they develop a 100% block and patient experiences chest pain, breathlessness, and all. So ECG shows typical changes of heart attack. That is heart attack. Heart attack doesn't mean cardiac arrest. Cardiac arrest is totally different. Everyone will die with a cardiac arrest. Okay. Heart attack also in cases where it leads to death, it leads to death because of cardiac arrest. So cardiac arrest is when heart stops beating. Heart stops beating. That is cardiac arrest. Heart attack is not the same. This is what I was talking about. 25% of all heart attacks are silent. They occur without chest pain. And diabetic patients are at a greater risk of silent attack. And the treatment for heart attacks also, it is best when we reach the hospital within time. Actually. So what happens when the vessel is 100% blocked? The muscles, they can withstand loss of blood supply for 6 hours. After 6 hours, the muscle starts becoming dead. So if there is an immediate treatment, if you reach the hospital within first hour and angioplasty is done and the vessel is open, then your heart muscle is not going to become permanently weak. Your pumping is going to remain normal. Even if the pumping has decreased at the time of heart attack, there are very high chances it will come back to normal within 1 to 2 months. But if you reach the hospital after 6 hours, even if the doctor does the angioplasty, there is no guarantee that the muscles will come back to life. Once the muscle is dead, it is dead. No treatment can revive the muscle because heart muscles don't regenerate. Whatever cells are formed at the time of birth, same cells will remain till you die. There is no formation of new cells once you are born. So once a muscle becomes dead, even if we restore the blood supply, we clear the blockage, we cannot revive the muscle. So time is of utmost importance in a case of heart attack. The moment it is diagnosed, you should reach the hospital. If you delay sitting at home, sometimes that golden period is gone. After the golden period, if we offer the same treatment, we can't have the same results. Okay, so heart attack, that diagnosing, detecting heart attack at the right time is very, very important. This is what is the cardiac arrest and heart attack. So this is what I was talking about. So I have explained in detail. This is regarding the arrhythmias. Arrhythmias, as I told, can be of different types. It can be a tachycardia, it can be a bradycardia when the heart rate becomes slow. When it becomes irregular, it is called as the fibrillation. There are treatments for this. There are medicines available. But first, we have to diagnose what type of heart attack you have.
What is heart failure, sir?
Yeah, heart failure is when the pumping capacity of the heart comes down. Normally, the heart pumping capacity is measured by a term called ejection fraction. So every time, every heartbeat, heart contracts and some amount of blood is pumped out into the vessels. So normally 60 to 80% of the blood which is there in the heart, it is pumped out during each heartbeat. So when this pumping capacity comes down, when it becomes less than 60%, then what happens over a period of time, you start developing symptoms of swelling in the legs. You can have little breathlessness on walking. So these are all symptoms of heart failure.
It comes through asthma or bronchitis?
No, any condition which will weaken the heart. Suppose if you had a heart attack earlier and it was not treated on time, your heart muscles become weak, your pumping goes down. Then later you can develop symptoms of heart failure. There are other diseases other than coronary artery disease which affects the heart muscles. Many viruses affect the heart muscles. Dengue also affects the heart muscles sometimes. So it will make the heart muscle weak. Your pumping suddenly from 60% it can come down to 20-30% after a viral infection. There are other diseases of the heart muscle, cardiomyopathies, where the heart muscle becomes weak. So there you will develop symptoms of heart failure. So once the heart muscle becomes weak, there you develop the symptoms of heart failure. Heart attack also leads to heart weakness of the heart. There the timing of treatment is important. If you are treated on the right time during a heart attack, then the muscle will not become weak, and later on you are not going to develop heart failure. But if you have a heart attack, it is not recognized on time, if the treatment is delayed, then some muscles are going to become weak, they are going to become dead, and they are going to become weak. Then later on in life, you are going to develop symptoms of heart failure. So once the pumping goes down, that is what is called as the heart failure. Okay.
So we see many people collapsing in the gym while working out, because nowadays there are very lot of youngsters. They are like gym frenzy. They want to go to gym, exercise. So can you throw us a light that why people get cardiac arrest in the gym?
Yes, the thing is, many of them can be maybe having some undiagnosed heart condition also. That is one possibility. Other thing is, exercise is good when it is done in the moderation actually. Too much of exercise is also not good. And yeah, while you are exercising also, you should maintain good hydration also. That is very, very important. Sometimes people don't maintain good hydration. They over exercise also. That is also not good for the heart. And for the heart, always some sort of aerobic exercises, or what we call in the gym as cardio, they are helpful. Weights are not helpful. Weights are detrimental for the heart actually. So while you are exercising also, you need to do more cardio and less weights. So that is also important. And sometimes there is a condition called hypertrophic cardiomyopathy. Sometimes that will be undiagnosed. So in Western countries, before enrolling in a gym also, they mandate people to one echocardiogram and then enroll in a gym, or when they are on high intensity exercise. They are doing high intensity exercises. So sometimes these diseases can be undiagnosed, and sometimes while they are exercising, they can develop some arrhythmias and they can suddenly collapse. Okay, so in any competitive sports also in the US, it is mandatory we rule out a hypertrophic cardiomyopathy by doing the echo. A simple echo can diagnose hypertrophic cardiomyopathy. People who have hypertrophic cardiomyopathy, they are not permitted to join any competitive sports also in US, because there they can have sudden death while they are participating in the sports. So sometimes these conditions may be undiagnosed in these individuals. Other thing is they can be having pulmonary artery disease also, and because of exercise, sometimes they can develop heart attack during the time of intense exercise. So exercise is always good in moderation. Extremes of exercise is also not good for the heart. And other thing is, there are some conditions which if you are going to the gym and all, better to have a echocardiogram done before that, just to rule out for the condition.
So how much time a person should spend in the gym in a day? It can't be like 3 hours. I think some people.
Yeah. Generally, the benefits that you have of exercise, suppose if you are exercising for 2 hours also, it is going to have the same benefit actually. Minimum half an hour should be devoted. Half an hour of moderate intensity exercise should be done. So your benefits are not going to increase if you are exercising 5 hours, 6 hours and all. So most of the people who do that sort of exercise, that is for bodybuilding many times. But cardiovascular benefit is with moderate intensity exercise. So if you do half an hour a day, that is sufficient.
They are saying nowadays in yoga, Kapalbhati, many people I see they do. Even that can lead to sometimes, I don't know how it's related, that there is an increased cardiac risk in patients who do Kapalbhati, this yoga exercise. They hold their breath, which is not advisable. I've read in some articles.
So I think all these things they should be gradually built up. So when you are holding breaths also, you have to gradually build your body. You can't hold breath right from day one for 1 minute. Gradually you have to build up. You have to build the capacity of the body. While you are exercising also, that is true. Right from the first day you can't exercise for 1 hour. Okay, you have to give the body the time to adjust to the level of exercise you are doing. So initially we advise patients to, even if they are starting walking also, we advise them to go for only 15 minutes. 1 week continue with 15 minutes, next week make it 20 minutes. Like that every week gradually increase the intensity of exercise, not try to go with the maximum intensity from the first day onwards. Because once you are leading a sedentary life, body also needs some time to adjust to your new schedule. Okay? So that is always helpful when you are doing in a gradual way, you are escalating your level of exercise. It should not be done to the maximum intensity from day one onwards. So, congenital and rheumatic heart disease, already I spoke earlier. So, congenital heart disease generally disease of children. So, generally right and left side of the heart there is no communication. This right side of the heart supplies blood to the oxygen, impure blood. Left side receives blood from the lungs and it distributes to the whole body. So, in children, what happens? There is no communication between the right and left. Sometimes in children they may have a hole connecting the upper two chambers of the right and the left side. Some children can have a hole connecting the lower two chambers. So this is what is congenital heart disease. So this is present right from the time of the birth, and many times doctor just puts a stethoscope and he can hear some abnormal sounds he can detect. Then he will refer to a cardiologist and echo will be done, and subsequently this can be diagnosed early in childhood. And many times these are easily correctable by means of surgery or some procedures also. Some devices can be put across the holes and they can be closed. So these are the generally diseases of the children. And many times where we have good pediatric facilities, these are picked up early in life. Sometimes even 1 or 2 days of life also these holes will be picked up. And they can be treated at the right time. These holes also, if they are not treated at the right time, then sometimes they can lead to heart failure in later life. So these holes also later the heart muscle becomes weak if they remain untreated for many years. So heart failure is the ultimate pathway for all heart diseases. Once the heart muscle becomes weak because of any heart disease, they will end up with heart failure. Okay. So these diseases are also important to recognize and treat early. If not treated, they can lead to heart failure. Similarly, this is rheumatic heart disease. This is one infection which is caused by an organism called streptococcus. It causes sore throat, but it affects the heart. So this was quite prevalent in earlier times when the socio-economic status, hygiene was not good. This type of infection used to be passed on from one person to another, and the prevalence was very high once India was known as the rheumatic heart disease capital of the world. But recent years, earlier we used to do procedures for rheumatic heart disease very frequently. But nowadays, in monthly 1 or 2 cases only we are doing. Earlier we were doing weekly 5, 6, 7 cases also. But now the incidence has come down because of improvement in hygiene, socio-economic status, and all.
Sir, even typhoid.
Ah.
In that also some people I listened, they will be having some heart problems because of typhus. Because nowadays Panipuri, everybody is.
About 10 to 11% of patients have diabetes, and this is going to increase in near future. And even the number of patients who have blood pressure or hypertension, that is also quite high. Even when we check the lipid profile also, lot many people have abnormal lipid profile. Their cholesterol levels, either their good cholesterol is less or their bad cholesterols are high. So all these are risk factors for development of heart disease. Once you have lot many people with diabetes, then heart disease is also going to increase. If your blood pressure, lot many people are there, your heart disease is going to increase, because these are all the risk factors for development of heart disease. Once you have all these risk factors, the more and more cholesterol gets deposited in your vessels, and you tend to develop heart disease later on in your life. So these are the risk factors for developing heart disease. So there are some risk factors which we cannot change. Okay, so they are called non-modifiable risk factors. Your non-modifiable risk factors are your age. So compared to a 60-year-old, 20-year-old will have a less risk of developing heart disease. So this cholesterol deposition is age-related. Younger people, less cholesterol deposition; elderly, more cholesterol deposition. So age is a risk factor. Your risk at 20 years will be less compared to your risk at 60 years. But age we cannot change. You cannot become young. You cannot change your age. So this is a non-modifiable risk factors which we cannot intervene and we cannot decrease. Compared to females, males also have a higher risk. Females have some female hormones, progesterone and all. So they are protective. They are protective, but once they develop menopause, their risk also increases. So at 60, 70 years, they have equal risk compared to males. But younger female, 50 years, 40 years, they will have less risk compared to males. So female gender also is little bit protective And then there is a family history. There are certain genes which you inherit from your parents. So if your parents had coronary artery disease or they suffered a heart attack, your chances of you also having or suffering a heart attack is quite high. So genes also are important. So these are the three risk factors which we cannot change. We cannot change the genes we have inherited from our parents. We cannot change our gender. We cannot change our age. So these are called non-modifiable risk factors. But there are other risk factors which we can change and we can decrease our risk. So among these modifiable risk factors, we have hypertension. Hypertension is nothing but high blood pressure. It doesn't mean if you have high tension, it is hypertension. Hypertension is a medical terminology for high blood pressure. Many people confuse. If you have more tension, it is called hypertension. That is not true. Medical terminology for high BP is hypertension. So if you have high BP, your chances of having coronary artery disease is high. Hyperlipidemia is nothing but high cholesterol levels or abnormal cholesterol levels. So that is also an important risk factor. Diabetes is an important risk factor. If you are overweight or if you are obese, then also your risk of developing heart disease is high. Apart from this, we have some lifestyle factors such as diet. If you are taking a diet which is very high in saturated fats, or if you are taking refined carbohydrates, too much of refined carbohydrates, then also it is an important risk factor. If you are smoking or using tobacco in any form, that is an important risk factor. If you are leading a sedentary lifestyle, if you are not going for any physical activity, all the time sitting and not going for any physical, then also it increases your risk. And there are some other markers in the blood. If the levels are high, then also your risk of developing heart attack is high. So these markers are homocysteine, lipoprotein A, and then there are some inflammatory markers. Even uric acid levels also, if it is high, then also your risk of developing heart attack is high. So how do we can prevent development of heart disease? So this modifiable risk factors, whichever is there, if we can control this modifiable risk factor, we can decrease our risk of developing heart disease. So if someone has diabetes, if they control their diabetes very well, if they control their diabetes generally being measured by means of a 3-month test which we call as HbA1c. So if you keep your HbA1c levels below 7%, then it is considered as a very good control of diabetes. Then if you have good control of diabetes, chances of developing heart disease in future will be less. Similarly, if you have blood pressure, you try to keep your blood pressure below 140 by 90 by taking medicines, visiting your doctor. You can nowadays instruments are available. You can check in the house also frequently. If it is not under control, you can see the doctor and get the medicine adjusted. And then if you have cholesterol levels also, then also there are medications which you can take. You can institute some dietary changes to bring down the cholesterol. So if you keep all this under control, blood pressure, diabetes, and your cholesterol levels, the risk of you developing heart disease in future comes down significantly. Apart from this, you should consume a healthy diet. You should go for regular moderate intensity exercise. You should maintain your weight in the ideal range. So for Indians, the BMI we call, BMI should maintain below 23. 23 to 25 is overweight, more than 25 is obese, means you are obese. So you should try to maintain your BMI below 23. So apart from that, we should know to manage stress also in life. Stress nowadays has become a part of life. So stress is also a very important risk factor for the development of heart disease. And if we are addicted to tobacco in any form, whether it is smoking, whether it is chewing tobacco or anything, so we should give up tobacco because tobacco is a very important risk factor in younger people. Heart attacks, what we see in most people who are below 40, only this factor we find in them is use of tobacco. In elderly people, other things are there, diabetes, blood pressure, and all. Younger people, when they come with heart attack, most of them, what this factor we found, most of them use tobacco. They are smokers, most of them. So that is also very important. Air pollution, we cannot do much about it, but air pollution also contributes to the development of heart attack. So actually this is the same things which I have highlighted. We should eat a healthy diet. The diet should be rich in vegetables. We can consume all fruits, and we should avoid saturated fats. Saturated fats, certain oils are very rich in saturated fats, such as we have coconut oil. Coconut oil is very rich in saturated fats. palm oil is there. Those things should be avoided. We should take oils which are more rich in polyunsaturated fatty acids. Okay, so generally in Western countries they use lot of olive oil. Olive oil generally has is beneficial for the heart, but olive oil is not suitable for our style of cooking. Olive oil doesn't remain stable at high temperatures. In Western countries, they will put oil only for flavor purpose. Actually, they will put it for flavor purpose. They will not heat it to high temperatures. The properties of olive oil changes once it is heat. Once we heat it to high temperatures, it doesn't remain olive oil once we heat it. So our style of cooking, we cook everything to high temperatures. So olive oil is good for their style of cooking. It is not good for our style of cooking. I see many people following the Western thing. Olive oil is good, but it is not good for our style of cooking. For our style of cooking, generally we have rice bran oil is there. That is good for the heart actually. We have safflower oil, not sunflower, safflower oil. That's Apollo gold and all that contains safflower oil. So safflower oil is also good for the heart. And apart from this, sunflower, groundnut, they are also good. They are a little bit lower down. Okay. Uh, Quantity of oil that we consume is also important. In a given household, for each individual, monthly consumption should be half liter. If we have a family of 4 people, we should consume 2 liters of oil in a month, not more than 2 liters of oil in a month. Other practice that we see in Indian household, once we fry something, the leftover oil we use to make some curries and all, that is a very unhealthy habit actually. Once we heat the oil to high temperatures, it generates lot of trans fatty acids. Trans fatty acids are very, very harmful to the body. So whenever we fry, we should try minimum, we should use minimum oil to fry anything. Leftover oil should be discarded, it should not be used again. So that is a very, very unhealthy habit. So, and processed meats and all should be consumed less. Fish is good for the heart. Fish people can consume. And apart from that, this is regarding the blood sugar. The HbA1c should be maintained to below 7. Blood pressure less than 140/90. Lipid profile should be done every 6 months, and we should, if it is deranged, we should consult the doctor and take medicines to bring it under control. We should maintain an ideal body weight, that is BMI less than 23, and then we should have some sort of daily exercise program, moderate level of exercise. Even brisk walking for half an hour is sufficient. We did not go to the gym, we can go to the park and just go for brisk walking for 30 minutes. Brisk walking is where we cover a distance of 1 kilometers in about 10 to 12 minutes. That is what is brisk walking. So if you are walking for half an hour, you should try to cover a distance of 3 kilometers in half an hour. That is what we call as brisk walking. Regarding the stress levels, nowadays it is very competitive world. Everything we have deadlines, timelines when we work. There is a lot of pressure from children's school, everything. Lot of so we should learn how to manage with stress. Actually, stress is also a very, very important risk factor in modern day. So learning to manage stress is also very important. Exercise is a great way of managing stress also. Once you exercise also your stress levels come down. There are other things, relaxation techniques, meditation. If you are having some hobby like music, or if you paint, if you read books, so you should inculcate some hobbies also. You should devote some time to your hobbies also. You should meet friends, relatives, talk out your heart. Those things are very, very important. So relaxation times and all is very, very important to bring down the level of stress. So this is regarding diet. Is so a lot of vegetables, lot of fruits should be consumed, and we should try to eat whole grains. We should not eat too much of polished rice. Brown rice is actually good for the health. And apart from rice, we should try to take other grains also, millets, java, wheat, everything. It should be whole grains, lot of whole grains. And proteins, may, as I told, fish is a good healthy protein, and we can take beans and nuts and pulses. Red meat and cheese should be avoided, and refined refined grains like white rice and white grain bread also should be limited. If we are taking bread also, multi-grain bread and all, they are more healthy.
How stressed the BP of
Whenever we are in stress, certain hormones from the adrenal gland will be released actually. They are called sympathetic hormones. All those they increase our heart rate and our BP. So whenever you are angry, you are anxious, you check your blood pressure. It will always be higher than when you are relaxed. So when we are measuring the blood pressure in the clinic also, as per guidelines, we should make the patient sit for 10 minutes, 15 minutes, make him relax, then measure the blood pressure. Then we are going to get the correct blood pressure. Otherwise, if anyone is anxious or sometimes the blood pressure can be falsely high. So this peaks which happens if you are in stress lot many minutes in a day, then this blood pressure will cross the normal limit. So those things can be counterproductive. They can lead to development of heart disease.
the issue with the adrenal gland when it was high BP?
Is that there are hormones which will be secreted by the adrenal glands. These are the response to stress. So when we are in a very stressful situation where it is essential for survival, then those hormones are essential to overcome that situation. But for simple things, if we become stressful, then on the long term, those hormones are counterproductive. They are counterproductive. They cause more. This is again regarding sedentary lifestyle. So sedentary lifestyle not only leads to increased risk of heart disease, it also leads to increased risk of developing diabetes. There can be some mental health issues also with a sedentary lifestyle. So it can lead to low self-esteem, low self-confidence. It can increase your weight, lead to obesity. And most of these people who are overweight, they also have poor sleeping patterns. They have a disease called obstructive sleep apnea also, which is very prevalent in this patients who are obese. And there is an increased risk of blood pressure also. So the increased weight can lead to all these problems. It not only leads to increased risk of heart disease. So this is what they call sitting is another disease actually, lack of physical activity. So there are a lot of studies which have shown that the risk of developing heart disease is quite high if you lead a sedentary lifestyle. What is the stress? Stress is undue, inappropriate, or exaggerated response to a situation. It may lead to physiological or psychological reaction in our body systems. Mainly, it leads to that adrenal gland activation, and then sympathetic hormones are increased. So, stress is a flight or fight response in the human body, and here it is helpful in certain situations. But when it happens for sometimes we can have inappropriate stress response. The situation may not be so grave, but our body responds excessively to it. There will maybe some simple thing, some discussion with wife in the family. We put lot of stress on ourselves. So that is what is counterproductive. Suppose if you are attacked by someone, that time you will be stressful. Some hormones will be released, and that hormones will help you fight out the attacker. That is a different thing. So in those situations it will be helpful. But for trivial things, if we get stressed, that is not helpful. So those things, what we can do, we can minimize by having some relaxation techniques, meditations, pursuing our hobbies, music. All those things help. So this is the stress response helps us to rise to meet challenges. Stress is what keeps us on our toes during a presentation at work, sharpens our concentration when we are attempting the game winning, suppose someone is in a competitive sports, that time all this can help you perform better. But beyond a certain point, stress stops being helpful and starts causing major damage to the health, to the mood, to the productivity, to the relationship, and to the quality of life. So what does stress do? It increases the breathing, heart rate, it increases the work of the heart, and it also increases the blood pressure. So it shortens the lifespan. Generally, there is a saying that everyone is born with a fixed number of heartbeats. Okay, if you look at nature also, animals which have slow heart rate, they tend to survive longer. Their lifespan is longer. If you look at tortoise, many species of tortoise they live up even up to 100 years. Their heart beating is very slow. Their heart beating, some of them is 25, 30 like that. Elephants, if you look at elephants' lifespan among animals is quite high. They live 20 years, 25 years. Their heart beating is also slow. But if you look at some insects, their heart beating is very fast. Their heart beating is 125, 150 like that. They survive only few weeks or few months. So in nature also, the people say you are born with fixed number of heartbeats. If your heart beats faster, you are going to use them up faster. So you die early. So similarly, stress, what does stress does? It increases our heart beating. Stress. So that is also one concept what we have seen in nature. So once if our heart beating is less, those people tend to live longer. So I think all of us are aware all these things lead to stress. So this stress, how it affects the heart, it can lead to blood pressure, it can lead to cardiac failure, it can lead to heart attack, it can also lead to brain stroke, it can also lead to arrhythmia, and sometimes it can lead to kidney failure also. All these things can be sick because of the stress. Because of stress people they can start smoking, they increase the alcohol intake, and all these things can be there because of stress.
In our office only there is a case. He was having BP. He was a BP patient. Someday he went for some meditation yoga classes. They told him, you don't need to use BP medicine, you start doing yoga. 6 months he was good. Suddenly one day, after going to OC expert, they find out he is having very high BP and something has happened, he died. Do you feel after continuously doing meditation, BP will reduce? Just like that, is it correct, sir?
The thing is this blood pressure also, there are two types of situation. One situation is when you are relaxed, your blood pressure is normal. When you are in stressful situation, your blood pressure increases. There will be one category of patients who will be like that. In those category of patients, probably if you learn to relax, if you reduce your stress, you may not need a blood pressure medicine. Okay? But there will be other sort of patients who blood pressure normal time also it will be quite high. When they are relaxed also, they will be quite high. In that, those type of patients, meditation, relaxation will not have a much impact on the blood pressure. They need continuous medicines to keep the blood pressure